in
Careful country, careful country, love the land, love the land. Blessed place and animals, blessed place and animals. Heavens. We thank the Watcher Barlick, the Jadwa, the Jawel Jolly, Wagaya, and the Youth Forgot People. Thank you for sharing our land, which we learn, rest, and play.
Thank you to the children from the Green Park Kindergarten for their delightful acknowledgement of country. Good afternoon and welcome everybody. My name is Ash Brooks and I'm the chair of By5. It's great to see so many faces on screen from around the region today, and we're absolutely overwhelmed with the support. To have over 450 registrations for our event is absolutely incredible. We'd also like to acknowledge our passionate guest speakers along with our Victorian Parliamentary members today. And we have Emma Keeley, our member for Lowen, Vanessa Richards, representing Western Victoria member Jacinta Ermacora, and Dr. Sarah Mansfield, also our Western Victorian member. We certainly appreciate your time in joining us. For those who might not be familiar with By5, the initiative was born out of foresight and commitment from our regional leaders, who, when presented with data about how the Wimmera Southern Mallee children were faring in comparison to children across the state, and more importantly those from urban areas, the divide was incredibly stark. It was clear that our children were being left behind. In fact, if you compared all of the states across Australia from the worst to the best performing, the Wimmera Southern Mallee children came in second after the Northern Territory. This significant red flag prompted some tenacious advocacy from these leaders, who were able to secure a state government investment, in turn turning the dial on these statistics. So this afternoon, we're celebrating By5's success and the transformational change that's been achieved so far. So as we hear from our guest speakers on their personal experiences and how By5's important work is making a difference for our children, who are our most precious asset and the future of our region, we hope our journey continues. However, the initiative's current funding is due to end on the 30th of June 2025. So just a little bit of housekeeping for today. Today we'll be recording the meeting, and this will enable us to share the event with those who haven't been able to join us. Equally, we encourage questions. Anything you'd like to ask us, please, we encourage you to put that into the chat box to the right of your screens. And as the questions pop up, if there's any that you particularly like, please ensure you hit the thumbs up button, as this will help us to prioritise and certainly answer as many as we can at the end of the session. Now, to introduce our facilitator for today, Professor Sharon Goldfeld, Director at the Centre for Community and Child Health. Not only is she an international expert on all things child development, but is also a true friend of By5 and the Wimmera Southern Mallee, having visited many of our towns across the region on many occasions, including the Gurrook Kindergarten, the Harrow Bush Nursing Centre, Japarrit, and she's even indulged in a night at the Dimboola Caravan Park, as well as enjoying one of the famous pink biscuits from the Bow Bakery in Rainbow. So with no further ado, I will now hand over to Sharon.
Thank you so much, Ash. And I too would just like to acknowledge the people of Kulin Nation, which is the land that I'm on today. Acknowledge their elders past, present and emerging, and particularly First Nations people with us today. I also want, before I go on, to acknowledge the amazing By5 crew, both on the ground, so Jo and her crew, and also the steering committee, ably steered by Ash, the very Ash Brooks you've just heard from. I want to just acknowledge what an extraordinary thing it is. We've been working at the Centre for Community Child Health with By5 for almost a decade now. And it's a real lesson for all of us in understanding how local people are able to come up with extraordinarily local solutions that work for them. But they're not local solutions that are just like trivial. They're fundamental ways of delivering services, the same services that everybody wants, but in ways that work for them. And I guess that's what Ash was referring to, the paediatric project that really emerged because children with developmental issues were simply not being seen and were on waiting lists. And then quite sensibly, together with initially then it was Billy Garvey and Rachel Robinson back then, co-designed this fantastic project, which was, what if we actually used the local health services and telehealthed in a paediatrician and worked with the local people to support the local health services to support the local children? And what if we did some great case study working with them? And what if we did capability building around child development across the community? What would that look like? And that's what thriving in By5 has looked like for the past few years, as that's actually gained energy and families are now being seen within 3 months instead of 3 to 4 years. And the local health professionals on the ground feel empowered and they understand their families and families feel like they're being listened to. So I just want to acknowledge the extraordinary intelligences that have been brought to bear to make that happen and the extraordinary energy of everybody that's made that happen. And now we're going to hear out of the mouths of people who are really on the ground. I do a bit of fate going in and out, but I do love the pink biscuits from the Bow Bakery. I will confess to that. Thank you, Ash, for letting everybody know that. Now, Ash, you'll have to help me work out who's first on our list of extraordinary speakers.
So first up today, we
Felix.
have Felix.
So just so everybody on the online knows, we're going to hear from about 5 people on their reflections about By5. Some of them have been on various videos. So if you see people and they look famous, that's why. And each of them are just going to talk a little bit about what it's meant for them to be involved with By5. So Felix, you're the first cab off the rank. Lovely to see you and hear from you.
G'day, I hope everyone can hear me. We recently had our computer system updated.
We can hear you.
Good. The By5 program is truly tremendous. It's an amazing asset to the Wimmera community out where we live. I'm one of the GP registrars in Horsham at Lister House Clinic, and there's a number of GPs here that utilise and engage with the By5 program, and it has been transformative for the type of care we can provide to young people and their families. It's no surprise that out here in the Wimmera, we live in a community that is disadvantaged from a number of different angles. The tyranny of distance is very significant out here, and many families can't reasonably travel the several hours they sometimes would need to reach paediatric care within any reasonable time frame, particularly if they have several young children, those with disabilities, or they're working, which often is the case with the families and patients we see. The Wimmera community is also disadvantaged from a higher burden of a broad range of illnesses, a lack of education and childcare services, as well as a relatively low socio-economic status as well. So it is vital that this community is supported given those disadvantages. The By5 program also detects and manages quite severe conditions. So whilst of course ADHD and autism and other neurodivergent or developmental issues are addressed, significant clinical cases also arise and are detected through this program that very potentially would have gone unnoticed and untreated if the By5 program was not in place. And this has included situations including domestic violence or harm to self and others. Like I said, the By5 program is able to identify serious cases and issues that otherwise would have gone missed. And part of that is the fantastic network which is the By5 program operates through, linking in healthcare providers, educators, childcare workers, families, all together to be able to identify those children that otherwise would have slipped through the cracks. The Wimmera community is a very cohesive, tight-knit, engaged community, given the challenges they face. And we find that some of the local experts on the ground are really able to identify and support families and children that wouldn't be put forward into the healthcare system otherwise. One of the greatest things about the By5 program is the education and empowerment it endows the healthcare providers and healthcare workers and childcare workers, educators, families that are involved through it. Certainly the GPs here and myself have learnt a tremendous amount about the paediatric care and care for young persons through this program, and the relationships we establish, particularly with the Royal Children's Hospital paediatricians, are invaluable. I can text, email, call paediatricians who are specialists in this area without a moment's notice, and I'm on good terms with them. They understand our community needs, they understand the families and patients, and that is, you know, a tremendous help and benefit to the healthcare workers on the ground that are often, you know, at a significant arm's length to getting expert specialist advice, and the delays are really unmanageable and not tenable otherwise. So I hope I've done a reasonable job quickly of demonstrating how invaluable this service is and really how necessary it is. A lot of the families that we see through this program just would not get access to specialist paediatric care if this program wasn't in place. And it doesn't take having done a Masters in Public Health to understand the broad-reaching ramifications of quality early childhood intervention. You know, this doesn't just help the individual in their life and their long-term trajectory, but also the family and then the broader community. If teachers are less stressed, they can provide better attention to the other children. The individuals and the families are going to better engage with society, and the ripple effects of the By5 program are frankly massive. From a financial perspective, I can't think of a more efficient use of government funding than to invest in early childhood development because of this.
Thanks so much, Felix. And just so the audience knows, each of these amazing people have been given very strict instructions about not speaking for very long. So I'm sure we could hear from all of them for a lot longer. And just to note, not many of you may know that actually Victoria has almost no public paediatrics. That is, people who are salaried to provide a paediatric service. There's a little bit of sessional paediatrics in some community health, but Victoria as a state really doesn't have much in the way of paediatricians who are providing care, support, capability building, capacity building out there in the community. So the fact that By5 has really thought carefully about how to solve this problem and demonstrated impact is extraordinary. And perhaps the greatest impact is on the parents themselves. And I think, Ash, have we got Jessie Ferguson next? Jessie Ferguson?
We do.
Yeah, g'day. How you going?
Hi, Jessie. So Jessie, you've got the floor to tell us all about By5 and you in a very short amount of time.
Yeah. So I'm Jessie and I live on a farm at Myja Lake with my family and our 4 kids and my husband, and I'm also a teacher in Horsham. And the inclusion of By5 program within our community has really increased our capacity as parents to seek support, guidance and assistance in regard to what our little people really need. And this program has become a really a sounding point for families and organisations alike. And I, for one, feel really comfortable contacting a number of these women in regard to assistance that I may require for my family and even as an educator in the Wimmera. Yeah. Can you get her an icy pole?
It's just a real live little person. It's just a live little person, Jessie. It's absolutely fine.
into becoming a mother, I found myself now really able to advocate for what my family's needs are. And I've created, with the assistance from local healthcare providers, a really solid support base for me as a mother. And I have absolute confidence in the capable healthcare providers that we have access to. I chose the healthcare model of midwife and doctor available to us in Horsham. And I was lucky enough to work with 2 midwives through Eden Hope and also Harrow for 3 out of my 4 pregnancies. And I think I speak for many women when I say travel is our biggest barrier, as Felix spoke about as well. Having battled postnatal anxiety and 2 premature babies, I was really quite anxious, even with baby number 4. So I knew I had to put into place some systems, and I'd worked with the Royal Flying Doctors Counselling Service before, and moving with those midwives that I knew really helped me. Our 4th baby was born 7 minutes after we got to the hospital. So being on farm and out of town in these areas, it requires a lot of precision to get us there to the hospital safely. And a quick phone call to that midwife enabled us to have the confidence to head to hospital knowing that we were going to be safe. By5 is this organisation that allows this process and those connections to work and continue through the birth stories and collaboration that they have now developed. They have a really strong foundation for positive relationships with many, many women in the district. And I feel confident when I say they're going to advocate for us because they know us, they know what support we need, and they know the circumstances we face and the battles on a daily. We have a lot of hurdles, and trying to know who to turn to and where to turn to is one of those battles. And having to navigate that personally and figure it all out was really quite hard. And now we have an organisation that's here to support us and guide us, and it's so wonderful. And they help us through healthcare, infancy, pregnancy, and now moving into childhood and school. It's really quite fantastic. Without these amazing organisations, and including in personal, the Harrow Bush Nurse Centre. Yeah, go to Louis. Louis, get her an icy cold. I would have a lot more kilometres on my car without having these people around close. I'd have hundreds of more Google searches, usually at about 2 or 3 in the morning. I think we can all speak to those. And I really think that without the help of these people and being able to access them, my mental health would have again declined with the birth of our 4th baby. But I now feel that By5 has given us this voice, and we are a community of really strong, capable and highly qualified individuals, and all we really want is the same rights and responsibilities as metropolitan women. Thank you. I'm going to head off. Thank you, By5.
Thanks so much. Now I've got tears, you're in trouble. And just, it's so wonderful to hear from Jessie. And just a reminder that one of the other challenges around antenatal care and the tyranny of distance for women who are pregnant, and how By5 has been trying to solve that quite pragmatically, because really the question on the table isn't for communities whether or not they should have antenatal care, but there has to be some ability to think about how that antenatal care should be delivered both safely and locally, and these guys are really trying to solve that. So now I have the pleasure of introducing Louise Mason, who's a speech pathologist. And Louise, over to you.
Thank you. I hope everyone can hear me.
We can.
Great. So thanks for having me as part of the panel today as well. I'm a speech pathologist working out of 2 of our Grampians Health sites here in the Wimmera region. I've actually been working in this region for over 20 years. And I'd have to say, prior to this By5 initiative and the paediatric project, I feel like we really didn't have access to paediatricians. Like you've said, there's just a real limit. I think beyond Ballarat, it's really hard. It was really hard to access a paediatrician. We're lucky we have one part of our hospital in Horsham now, but that's also sort of a new thing as well. So I feel like, as a speech pathologist, we're often one of the first health professionals who might see young children in our region who get referred in for concerns around developmental delay. And our other sources that obviously we work closely with from a young age would be maternal and child health nurses and GPs. And so this model has really, I think, brought us even more closely together in terms of identifying families and children early who need some support. And I think, like Felix touched on, also has brought us together in a sense of the education element that was new, I think, and bringing us all together across local government areas. So prior to that, we would have been very much sort of part of our town or our local government area. So By5's been an amazing new model that's bringing us from all over the western side of Victoria together to sort of learn from each other and problem solve together with our families. So I think that's been an amazing sort of part of this model that we didn't have before, and I think has worked really well. So I feel like in my sort of experience too, this program has really enabled early referral to paediatricians particularly. So often, as you've alluded to, some of our guest speakers, like the wait times are really long, and we were so lucky we've been able to get them down to 3 months to get an appointment with a Royal Children's Hospital paediatrician. And that co-consult model of being in there together, and sometimes I've personally also had the parent sit next to me in the meeting, because knowing sometimes technology is a barrier for families, as in they might not have Wi-Fi where they live, but also just, you know, how do I get online? How do I attend this meeting? You know, and so now having that model where they can sit in the room with a professional that they know really well, and be part of that and get the support if they're unsure of how to answer a question or things like that. I think that's been amazing. So that collaborative health model with, you know, a paediatrician, a health professional, a maternal child health nurse, like we can all be part of those appointments together. And I think that's really alleviated some of the barriers of costs of travel, as we've said, of accommodation costs that can also come into these appointments sometimes. And I think just the cost of the appointments as well, as we know, like attending a private paediatrician is a very pricey thing. And so this has opened up a new option for our families. And I think this early referral that we've been able to do has then facilitated really specific, detailed referrals on from that. So instead of us waiting 6 and 12 months and going, oh, we might really need to get some other professional involved, I think because we all are coming together really early, our paediatricians at the Children's really help get the right referrals going in the right directions. And particularly when families need ongoing care, that might be more than what the By5 service offers. They get those referrals in place. So I think, like, I guess in summary for me, I feel like this model has definitely ensured that our rural families and professionals have access to equitable services to our metropolitan counterparts. We've got the more learning opportunities for professionals, and we've got access to health professionals that we previously did not have access to in some parts of our region. And I think that that's really important to note, that we really were disadvantaged in that space. I think this model of care that we've had has been really well received by families, and I think by health professionals. And I've noticed already, because we can't make new referrals at the moment because of potential, funding ceasing, I've already noticed that's been a big change, and we're referring to other services where wait lists are beyond 2 years in some cases. So I think I can't speak highly enough of the program, and I'm really hoping we can continue in a model in some way.
Thanks so much, Louise, and in particular for talking about the equity issues. And I just want to also note the cost thing, because people might listen to this and go, oh, but it costs money. But before, the people who were managing those costs were the families themselves. So now what we've done is decrease the cost to the family, but also thought creatively about how the system can repurpose itself to better meet their needs. And I was just reflecting, Louise, as you were speaking, and before Colin gets on as well, just to say, what's been created here with By5 is a fabulous proof of concept. I think everyone will agree it's not necessarily the perfect, but it's a great proof of concept that's trying to learn. The question I would be asking myself, and maybe somebody out there might be asking themselves, is how do we start learning and scaling this proof of concept? Not just how do we sustain By5 in the Wimmera Southern Valley. That's a nice to have. But what we should really be asking ourselves is, how do we do this over all of Victoria and maybe over all of Australia? So that's the question I'm going to see for you. And I know just the person who's going to talk very creatively about this, which is I'm going to hand over to Colleen Peschel, who's the principal of the Rainbow 0 to, or P to 12, not 0 to 12. Well, actually, it probably is really 0 to 12 college in Rainbow, where I visited. And Colleen, over to you. Colin, we can't hear you. You don't seem to be on mute, but we still can't hear you.
Now, can you hear me now?
Now we can hear you.
Excellent. I've taken off the headphones.
It seems to have done the trick.
Okay, so thank you very much. Our relationship with By5 has been an absolute game changer for Rainbow P12 College. Just to give you a bit of context, our school was struggling to get allied health services out to the school due to an overworked and understaffed Department of Ed support services. So until 2023, we hadn't seen a speech therapist for over 5 years. We hadn't seen OT on site for 3 years. Hadn't seen psych for way over 5 years. There was an 8-month wait for any cognitive assessment. So the school had to basically go into private practice to get any cognitive assessments we needed. And the school nurse visits were spasmodic and often occurred at the end of the year, which wasn't really any help to our new preps at all. So basically our junior students with extra needs were falling through the cracks. Staff didn't have the time, expertise or confidence to support them effectively in these areas. And the staff were struggling with that feeling that they were letting our kids and families down. So then one day I received a phone call from Joe Martin from By5, who wanted to link us up with an organisation called Royal Far West to pilot a program of the combined weekly telehealth sessions in speech, OT and psych, with 2 outreach visits a year. And the rest is such a good news story. So linking with Royal Far West had such a positive ripple effect. It closed the gap. Kids were no longer falling through the cracks. They were being noticed. It allowed our kids to catch up and build their self-worth and their confidence. It provided strategies and support for students, staff, but also parents. It built staff capacity, and it gave our kids that extra caring adult in their life, which was so, so important. We were so impressed with the service at Rainbow that after the pilot program, the school decided to fund another year of the program out of school funds with help from By5 once again. And this year, as part of a small cluster, we've worked out a cluster arrangement with Royal Far West. So it's not only gone to Rainbow, but it's gone to schools in our cluster, which is Beulah, Jeparrett, and a couple of schools in Hopeton. But the program's not cheap, and schools covering the whole cost is not sustainable in the medium to long term, as we only have access to limited funds that specifically cater for these services. And this is where By5 has once again come to the fore by providing funding and trying to find a way to access funding from other sources and navigating a very confusing and frustrating system so that we can support programs like Royal Far West in schools on a more long-term basis. Without our relationship with By5, we may never have heard of Royal Far West. The connection to their program has genuinely changed the life trajectory of some of our students who now have the opportunities to feel success with their learning. It has allowed our staff to develop their skills and has reduced the stressful burden of the feeling that we were letting our kids down. And it's also allowed our community to see that living in remote rural areas does not mean that we have to accept the tyranny of distance as a complete disadvantage. So for me, By5 is laser focused on providing kids and families in rural areas with a chance to thrive, a chance to be optimistic, a chance to access opportunities that others take for granted. In simple terms, I see By5 as the glue that holds us together and fights to keep that dream alive, and By5 gives us hope. It would be devastating for our community and others like it if they were not able to continue the fantastic work they have started. So hopefully that gives you a snapshot of how important and valuable By5 is to the Rainbow community.
Thank you so much, Colleen. And can I just say, so Royal Far West, I think we see as part of, I think we feel quite good as a matchmaker there. I think we brought the matches together. But I always say to people, Colleen, that, that you guys are kind of funding it out of the, the change down the back of the couch, and that's just not a really sustainable model. So they've got this kind of disconnect between the funding actually available and the funding you're allowed to use, which is just kind of crazy. And what By5 does is just really lean into this local problem solving and just go, okay, let's just throw the rules out for a bit and actually focus on what the children need, not what the rules say. And that's really what you want someone locally to do, isn't it? To just go, don't worry about the rules, just worry about the kids. So thank you so much, Colleen, and lovely to see you again, and good luck with everything at Rainbow. Now, I think our next person is Kathy Tischler, who's going to be talking to us from a regional perspective. And Kathy, I think you're the last of our rapid fire salespeople here. So over to you.
No worries. Sharon, can you hear me?
You can.
Great, good. I'd love to jump off Colleen's point and talk about hope. So I want to talk today about the impact and knowledge of By5. So you've heard so far that By5 has done some absolutely great work in terms of bringing people together, providing some physical and tangible and pragmatic solutions to some of the challenges that happen in our region. But By5 is also changing policy and changing thinking about how we do rural engagement, how we do rural investment in outcomes for our families and children. And it brings a reality of ownership of those problems to our communities as well. So it's one of the few things that I see in a region where we can participate in it and have some influence over policy outcomes, engage people who are experiencing these challenges, and have them co-design a future that works for all of us in the region. And I think the real importance of By5 is that it brings hope to our communities, and it brings us an ability to reverse some of the trajectory of loss that we feel that happens in rural communities as services shift and change and respond to the whims of various different governments. We actually, through this program, we actually have some control over that and can design things that work well for people. And like some of the previous speakers have said, it doesn't often require more investment. It just requires matching investors to the outcomes that we want to see and brokering a lot of those relationships. And By5 is absolutely critical in our region in terms of brokering those relationships. And when I talk to rural people all over the place, I'm a social and economic researcher who lives out in the regions. And when I talk to people, like, one of our key frustrations is we just don't have the resources to address this next problem that's happening. By5 is in the space of being able to nimbly move between the systems that exist in our region and actually pragmatically think about those things and try and test some solutions and work with people to actually make things happen. So some of the really exciting higher level policy things that I've seen happen with By5 that I'm really proud of as a Wimmera person is that we were the first rural group to approach the Productivity Commission during their review of childcare at federal level and engage with them and say, look, you need to think about rural people as well. Our experiences with childcare and access to childcare, and even just having any sort of childcare in some of our communities is almost an impossibility. And we need to think about that differently to how you fund urban childcare. And our participation in that policy process has been really critical in starting to move that trajectory around how we think about rural childcare. From that, we've been able to engage much more broadly with a range of philanthropic, federal government, federally focused organisations and other regional networks around changing the trajectory of childcare in rural settings as well. So I'm really excited about that and the potential that has to grow over the next few years if we can continue this program. I think the ripple effects
of By5 are really, really important. I think it's a critical piece for reinforcing the importance of families in our region, reinforcing the experiences of women, and reinforcing the experiences of children. That's what I would like to add to this conversation. Thank you.
Thank you so much, Kathy. And I love that you've ended on what's really important, which is putting children and families at the centre and then looking at how the rest of the system can orient itself around it. And what By5, I think, has done in an extraordinary way is taken the voices and the thoughts of the local people and then said, how do we repurpose the existing system? There hasn't actually been a whole lot more. There's been little bits, but it's on the edges. It's really been, bugger this doesn't work for us. What if we took the same stuff and offered it somewhat differently so it actually meets the needs of our population? And that's what I love about By5. It isn't, please, can we have tons more? It's just, can we repurpose and can you just fund a bit of the glue that helps all of this work together a little bit better? So it's very exciting because I think there are so many learnings from By5 that are relevant to the rest of the country, where really we are in this environment where there are not a lot of resources everywhere, but man, they're inequitably distributed. So to your point, Kathy, how do we make them much more equitably distributed, particularly to children and families living in rural, regional and remote areas where sometimes there isn't ever going to be bricks and mortar, and what sort of things can we do to make a difference? So I just want to note to everybody, there's fantastic comments coming through the chat. So please do read them. I don't think we've got all the answers to all the excellent questions that are coming through, but they're fantastic. And I know the team will be looking at all of them. And also to note, we've got about 230 people who are online. So I think the By5 crew will certainly be feeling like they're being listened to. And a shout out from me, from the centre. I think, Ash, I'm handing back to you. Is that right? I can see you, so you can nod yes or no. I think DJ's coming next. So just a big thank you from the Centre for Community Child Health for allowing us to be on this journey with you, By5. And a big thanks to Gehan Roberts and also to Trina Hinkley, who are kind of your journeymen at the moment. But back over to you, Ash.
Thank you very much, Sharon, and thank you very much for joining us today. Your support of By5 is always amazing. We love the fact that you have such a good understanding of the region and are so passionate about the work we do. And I think some of your comments around providing us and us being the glue that connects between some of the systems to ensure that we develop fit-for-purpose solutions is, yeah, absolutely correct. I'd also like to thank our speakers today. Your stories are absolutely inspirational, and certainly, you know, hearing from you all around how your lives have been touched by By5 is excellent, and you certainly have been so integral to the By5 movement. Now, just before we jump across to some of the great questions that we have appearing in the chat today, I'd just like to call on David Joe Hinkie. He's the former chair of Regional Partnerships. And so just a little bit of background on DJ. So he, along with his colleagues, had the foresight many moons ago to see improved outcomes for the Wimmera Southern Valley and our children. So DJ, after you've heard obviously our great speakers today and you've sat here and heard from Sharon as well, how does it make you feel based on, I suppose, the great achievements that By5 has made?
First of all, I'm really proud of everybody who's been involved with By5, and By5 is a really classic and true example of place-based engagement, not only with the community, but also focusing on what an outcome should be and not getting caught up in the political sphere of which department should lead what process. To hear the outcomes, to hear the genuine effect that we've had in those early years of the most important people we have, and that's the next generation coming through, is the part that's so rewarding. As we talk about By5, I do reminisce, and I'll just, if you let me indulge for a moment, Ash, about how we actually got to where we are. And people may not even know why we call it By5, but I have to first of all give a shout out to Jo and all the work that she's done through the journey. Jo, you're an absolute legend, and we love and respect everything you've done. But two other people who should also be noted is Emma Vogel and Caroline Harndorf, who were my vice and my guest resource when we started Regional Partnerships. The whole reason we have By5 is from a conversation before an assembly, which is what we used to have to discuss regional issues. And the Premier, we sat him down and we said to the Premier at the time, Mr. Andrews, that we had a fairly huge issue, as was mentioned earlier, that our children were falling behind in every stat you could get from their development. And the only way we can resolve that is to bring health and education together. And he simply said, well, if you've got some guts, let's get on with it. It wasn't what we were expecting, so we sent a press release out the next day to lock it in, so we couldn't turn back on it. And then Emma and I went on the merry journey of going to everybody in both the Department of Health and Department of Education to say, you've got to pull your heads together and pull this and find some funding to make it work. Because this program doesn't naturally fit in either of those spheres, but it's mutually beneficial to both. And that's the real point here. That's what place-based is about. It's about bringing things together that aren't necessarily a natural alignment to get the outcome that what we need. And the whole attitude was we were given 5 spots. We could do this as a pilot program for 5 locations. And if you look at the Wimmera Mallee, 5 doesn't anywhere near cut the mustard. So we decided that we'll have 5, but we'll create 5 clusters that we would work with. So we turned 5 into, well, almost the network that you see today. It's growing, and thanks to the great work of the team. That's the reason why we call it by 5. It was 5 clusters that we started with, and everybody who had the foresight and the love and passion to get involved. But ultimately, if we're serious about the development of the Wimmera, if we're serious about having place-based outcomes, this is a true and authentic way for that to occur. And for me, if we can't see a pathway to continue this program, it would be absolutely devastating, not for the people involved, but for the people who need it the most. And they're the ones who aren't on this call. They're the ones who haven't got a voice yet, and they're the ones who need it the most. So for me, I'm absolutely proud of what everybody's done. This has been a long journey for everybody involved. There are many hands to make this work. I just want to say thank you to all of you, and I really wish the program gets the support that it deserves. And as far as I'm concerned, I fully back this in. Thanks, Ash.
Well, thank you very much, DJ. Yeah, absolutely agree with what you're saying. We absolutely need to keep By5 going. It's integral to our children. They're the future of our region, and we are hopeful that we will continue. So now we might just move across to a couple of questions. Thank you so much to everybody that's been kind enough to put those into the chat. I'm really enjoying seeing some of the heartwarming comments that come through. Just looking at time and conscious that you've all kindly given up time. So we've probably got time for 2 questions. So first question that we're going to be able to answer is, how has By5 helped raise awareness regarding the lack of EC in the Wimmera Mallee? So going to Kathy's point, around EC, what By5's been able to achieve is to be able to establish and understand some of the challenges that we really face, how this is different to metropolitan and certainly remote areas as well. So being able to create physical and tangible solutions, and By5 has done that by creating a model which has certainly been evident in what's happening at Matoa this year. So By5 has developed a tailored model which is specific to our rural needs. It supports the provision of accessible and high quality EC care, and appropriately funded as well. I think, as Kathy so well articulated, it's not always about needing more funds. It's about using those funds wisely, and certainly making sure that, you know, the solutions do fit the local regions that we're operating in. I think what's also been really great about By5 in regards to the EC space is the advocacy that they've done, the networks that they've created, and how they've been able to amplify our voice. So not only has Jo and the team certainly presented to at the parliamentary roundtables, which was held with Nathan Lambert last December, but also being able to speak directly to the Productivity Commission. These opportunities are game-changing and certainly highlight the challenges that we face. And certainly, as you'd all be aware, 11 of our 19 towns across the region with populations over 300 don't have access to childcare. So being able to speak to that and highlight that we absolutely need accessible childcare has been instrumental. One other question that was raised just by Amelia, I will just scroll down to that. What has government's response been to this crucial program in terms of an ongoing sustainable model that can be upscaled and rolled out across the country? I mean, as you've all seen, By5 has generated exceptional value for the region over the last 4 years. As we all know, change doesn't happen overnight. It takes a long time to be able to embed long-term systemic change, and certainly a second round of funding would absolutely enable By5 to consolidate against some of the great work that's already been started. So we are looking closer to home and working with partners in the central region to be able to spread and scale some of the opportunities that By5 have created. Loving reading through all of the positive comments and so touched by what everybody has to say today. In the interest of time, what we will try and do is answer some of the other questions and put some of the responses on our website. So we'll create a Q&A document de-identifying obviously people that have asked some of these fantastic questions, just so that you can go away and ponder them a little bit further. So last but certainly not least, what I'd like to do is now hand over to Emma Keeley, our local member for Lowan, just to make some final remarks for today's event.
Thank you so much, Ash, and thank you everybody who's joined today. I am yet to hear of one single person who hasn't been an amazing supporter of By5 and been able to beautifully articulate what that means for our region. I've got my little helper Ella here today. That is who motivates me to do a bit better in everything that I do, and part of informs my decision making. And given that we've had so much support on both sides of politics around this program, I don't think we need to sell that message. It's really just making sure we get that small portion of money allocated in this year's budget. I just wanted to commend the By5 team and everybody else who is around that, who have been such strong advocates in the respectful, the well-informed and the evidence-based approach that you've taken in selling the message of why we have to have By5 continue to be funded into the future. Sometimes you see when there's an idea put forward, it doesn't have the backing of research, and Kath and others have contributed so much. The Children's, I'll mention Sharon as well. It's lovely to see her on online. I haven't caught up with her at the Children's for a couple of years now, but we've got great research scientists behind it. We've got great people behind it. We've got the medical fraternity behind it. We've got communities behind it. I don't think that anybody questions the value that this program offers to not just our young ones, but also to families who live, work, study and do business in the country. I will continue to do what I can to promote and get that support flowing through, which turns into, as I said, a very small amount of money. While we've been sitting here, I looked up the media release actually from back in September 2021, where it appeared ministers were lining up to talk about all the wonderful things that By5 is going to do through their last tranche of funding. I think that case has got even stronger, and that is through the good work of everybody in this room and beyond. Congratulations and thank you so much for everything you've done for this. We'll continue to fight for more money. Don't write it off just yet because we haven't had the nod. It's one of those programs that I'm sure that we can make sure we can deliver in the region, and not just throw all that good work away, but make sure that we continue to have a flexible and embedded program that supports the education and better health outcomes for our young people.
Thank you very much, Emma, and certainly appreciate you joining today. So let's keep going with By5. We're going to finish what we've started. So enjoy your day, and we look forward to speaking with you again soon.